We're live now. Good evening, everybody. COVID pandemic and its impact on mental health. It gives me indeed great pleasure to moderate a webinar of such immense importance on the platform, on the combined platform of Scope and Fam Health. Mental health and well-being, especially in these COVID times, is indeed a pandemic within another pandemic. It's unlikely that anybody in this year 2020 has not been affected by what's been happening around the world. Why are we so anxious? What and how severe is the impact? Does it relate to the neurological structure of our brain at all and of our body? To discuss this and some of our very, very critical of our brain questions and that are disturbing to discuss us, this and allow us to sleep at night, so on and so forth, we have a highly distinguished panel of psychiatrists from India and abroad. I will request Mr. Atul Sopti in just half a minute to introduce our eminent panelists. But in order to take the constructive points, may I request everybody who has questions on mental health and how to cope with this better to please send, type your questions on the questions tab, which is available on the screen. And we'll make it a point and I'll do my utmost best to make sure everybody's are answered. Just in case I'm unable to cover all the questions today, please keep sending your questions, either post them on the Scope social media sites, or you can log into famhealth.in/community, free registration. You can leave your questions and we'll do our level best to make sure that we do respond to each and every question. If we need to do another webinar, we will. Just, before we start introducing our panelists, maybe I should tell. I'm Asha Kapoor, Managing Director of Fam Health. Fam Health stands for Family Health, and it's a platform where we believe that families across India and the world need better support to be able to deal with lots of unanswered questions. To this end, we run a TV service with Tata Sky. It's called Tata Sky Family Health. It's available on 510 on Tata Sky set-top boxes and famhealth.in. Okay, so to come to address the webinar, and in order to make it constructive, and we've got many, many speakers lined up, I'm going to, without further ado, call upon Mr. Atul Sopti, Director General of Scope, to say a few words and welcome our eminent panelists on our webinar, COVID pandemic and its impact on mental health. Mr. Sopti is a visionary. He's a leader with close to almost 4 decades of very versatile professional experience. Sir, you were the CMD at BHEL before you joined Scope as the Director General. We have no doubt, and given the popularity of the webinars that you're conducting, that you will take Scope through your initiatives to even greater heights. May I call upon you, Mr. Sopti, sir? Let's kickstart this webinar, please.
Thank you, Ashaji, for the nice words. A very good evening, everyone. Since today, we are joined by eminent experts and participants from across the globe. Good afternoon to all joining from the East Coast, including Italy, and good evening to all joining from USA. It's indeed a pleasure to be amongst the distinguished panel of the experts who have not only joined from India, they've joined from Italy and USA. Probably the only one thing the pandemic has impacted positively is our connectivity across the globe, which we are seeing today also. It's very rare occasion that one is very happy to be amongst the doctors, and so many doctors. And for me today, it is one such few occasions. Ladies and gentlemen, Standing Conference of Public Enterprises, Scope, you might be aware, is an apex body of Indian public sector enterprises known as state-owned enterprises internationally. Besides policy advocacy, we represent employers in various national and international forums, conduct studies and research, and we also organize various programs for the capacity buildings of public sector enterprise as well as other corporates and their families also. During the pandemic period, so far we have already organized 30 webinars on a variety of subjects, and all these webinars have got the overwhelming response. Scope as the membership of various public sectors, which employ nearly 1.5 million people, around 15 lakhs. It's such a huge employee base. It's always natural that we need to take care of the human resources, which are the most important assets for any organization. For this purpose, in fact, at Scope, we have been organizing the talks and awareness campaigns on various guidances for the healthy people. And in fact, during this pandemic period also, we organized a webinar to provide a guidance on the healthy heart and healthy lifestyle. We had the association with the partners for organizing that webinar, including the Fem Health, with the doctors from USA and India, which also got overwhelming response. While Scope has been addressing the physical health concerns, we thought it pertinent to even address the issues surrounding mental well-being, especially given the uncertainty and growing fears surrounding the pandemic. For this purpose, as was mentioned by Asha Kapoorji also, we have the eminent panel of medical experts who have been doing extensive work in the field of psychology and mental well-being. I am honored to welcome Professor Stefano Palanti, joining us from Italy. Professor is a physician scientist and is associated with many institutes in US and Italy in the field of neuroscience. He is a well-known name in the world, in his field. I would like to welcome Professor Palanti, and I'm thankful to him for sparing his valuable time. It's also my pleasure to be joined by Dr. Ranjana Verma from Maryland, USA. Dr. Verma has been working in the area of child psychology, a very important subject, for over 25 years. Welcome, Dr. Verma. I would also like to welcome Dr. Amita Shah, who is associated with Max Super Specialty Hospitals and Holy Family Hospitals in Delhi, NCR. Dr. Shah, he has been contributing effectively in the field of psychiatry for over 2 decades now. Welcome, Dr. Shah. We are also glad to be joined by Dr. Anjani Nagpal. She is CMD, Serenity Clinic, and she has many accolades to her name in the field of mental well-being, and we are pleased to have her with us today for this webinar. Welcome, Dr. Nagpal. I'm sure that the acclaimed panel with us, all of us would agree that while it is important to have everybody talking of the strong immunity, it's very important, but it's equally important to have a strong and calm mind to deal with the uncertainty, to deal with the pessimism, to deal with the gloominess in the present environment. In fact, mental health is not only significant for surviving during this pandemic period, but also it's an important tool to help preserve and reconstruct in the post-pandemic period. Very important. So the most important mental health aspect that the pandemic has stirred is the unimaginable and surmountable emotions that people are experiencing, which are not only diverse, but are varying in extremities. The new realities are working from home, temporary unemployment, or in some cases permanent unemployment also, homeschooling of children, lack of physical contacts with our family members, friends, colleagues, they are taking toll on most of us, and some are responding to it with extreme measures. If I talk about the facts about the mental health, there are endless list, but just few instances I like to mention. In India, in fact, since April, there is a spurt of over 80% of distress calls for suicide prevention helplines. In fact, a survey was recently conducted. As per that survey, today 61% Indians are experiencing mental health related issues because of the uncertainty, because of the gloominess, because of the financial crisis. It's not only in India. This thing is happening across the world. If I talk about USA, as per a study, there is 1,000% increase registered in emotional distress calls since April 20 as compared to the last year. Further, there is I know that there is 65% jump has been registered in online therapy. And the most scary is the WHO prediction, which predicts one suicide attempt every 2 seconds if situation is not controlled soon. While these statistics appears to be frightening, scary, it is important to deal with it rather than ignore it. The webinar of Scope and Fem Health sincerely attempt to nip the disease in the bud rather than take it to the level of mammoth phase. I am thankful to our partners Fem Health, which is led by their dynamic MD, Mrs. Asha Kapoor, who started this webinar in the beginning, for hosting it and subsequently telecasting it on the Tata Sky also. I am certain that international and national experts would guide us through the steps to deal with the unknown crisis in our minds, and they will train ourselves to be stronger human beings. I request all the participants to make maximum use of this opportunity and ask their concern with open mind. Question answer system has already been told by Asha ji. Please be free to ask any question. We'll try to reply to all the questions, and subsequently also, if you are not able to reply due to the time constraint, we'll definitely ensure that these are sent to you. Please remember that anything which bothers us, which troubles us, cannot be small. So please, as I mentioned, make maximum use of, maximum benefit of the guidance of the experts who are here. I wish the webinar a great success. Thank you very much. Thank you. Over to Asha ji.
Thank you so much, Mr. Sopti, sir. You raised some really vital statistics, and they don't seem very pleasant. And I'm sure, like you said, with the support of this fantastic and eminent faculty, we should be able to understand this condition just a little bit better. The first speaker we thought would make the most logical sense would be to look at the global impact of the pandemic to understand what is really going on with mental health and our psychology and the impact on our neurological systems. And who better than Professor Dr Palanti to take us through this entire session. I want to read out a little bio, with your permission, Professor, on what I've gone through about your background. So you're a professor of psychiatry at the University of Florence and director of the Institute for Neurosciences in Italy. You are a professor of psychiatry and behavioral sciences at Stanford University Medical Center, Stanford, California. You are a visiting professor at Albert Einstein College of Medicine, New York, USA, and at Imperial College, London in UK. You're an adjunct associate professor at Icahn School of Medicine at Mount Sinai, New York, USA, where you have served as the founder and director of the Strategic Center of Excellence for OCD, Impulsive, and Behavioral addiction. Dr. Palanti, as Mr. Sopti had mentioned, you describe yourself as a physician scientist who applies cutting-edge neuroscience breakthroughs to clinical work by utilizing clinical activities to formulate research hypotheses. We're really intrigued, sir, to know and to understand your observations on mental health in this pandemic. We know it's a very difficult pandemic, so please help us understand neuro-COVID-19, a clinical neuroscience-based approach to reduce the SARS-CoV-related mental health sequelae. So, sir, if you can have your presentation, that would be amazing.
Thank you very much for your nice introduction. Thank you for having me today. I'm very pleased to join this prestigious webinar, and I'm very pleased to have this collaboration with your country and with the people that I love from India. So as you have introduced, I am a clinician and I am a scientist. And some of the observation that I'm presenting has been taken during the last few months when back from 2 years that I spent in Palo Alto working at Stanford, I was surprised in Florence by the start of the pandemic of the COVID-19. So as usual, I take the opportunity to study things that I was facing in my clinical activity of every day in the academic hospital here in Florence, where we have admit a few hundred people with less or more severe form of respiratory acute syndrome due to the COVID-19. So the first slide is about a true case report that I see more recently. This is to introduce all the issue. This is a young, is a lady that has been suffering, but without being aware of a mild form of COVID-19 in February, when the awareness about this pandemic was not the same that year. So she considered had just a severe seasonal flu. And she was not, at that time, she was not diagnosed as COVID-19, because at that time we were not concerned about that. After a week that she spent in bed due to the severe condition of this, that she considered a form of influenza, we say flu, in March, she asked, after a month, she asked for a psychiatric assessment, because she was experiencing some behavioral and mild neurological symptoms like headache, pain, fatigue, dysfunctional worries, being tense, difficulty in relaxing, difficulty in concentration and focusing, and hopeless, pessimistic. And at the end, she also developed some kind of obsessive compulsive rituals. For that, she was addressed to a CBT therapist to get some form of cognitive behavioral therapy. And she spent a couple months through this kind of treatment. Then she presented to my office, and we decided to pass through the assessment of a potential threat of COVID. So she got a swab that was negative, and then she got a serological assessment that shown the presence of anti-COVID-19 antibody, and also elevated level of EGG, EGM, and other inflammatory index like high C-reactive protein levels, erythro rates above the reference level, high level of alpha-1 and alpha-2 globulins. So we understand that his suffering was related to the COVID-19, and so we decide to. I can see my presentation. I hope you can see it.
can see your presentation and your video, sir.
Okay. So she started a different treatment, a medical treatment that was replacing the CBT treatment with naproxen, that is an anti-inflammatory agent, and fluvoxamine. Fluvoxamine, that is SSRI, but at the moment is being registered for a clinical trial for the treatment of the acute phase of COVID-19 cytokine turmoil because of its important action of immune suppression through the action of a sigma receptor. So we make a tutor. That allows me to have a better understanding of a potential risk of a patient exposed to COVID-19, not just of a psychosocial risk, but also the risk of a direct effect of a virus on the central nervous system. Because we know that COVID-19, like all the other coronavirus, have a potential threat not only for the respiratory apparatus, but also for the central nervous system. And we know that have to bind the angiotensin converter 2 receptors. And this receptor, not only on the respiratory system, but distribute on the brain. So that could be one of the mechanisms. While other mechanisms can involve the blood vessel, we know that can pass through the endothelial barrier, and other retrograde flow through the peripheral nerve to the central one. And presence of COVID-19 antibody has been documented in the cerebral fluid. So we are sure that there are potential risks for neurological system. And this has been clear from the beginning because since the very first paper published in February from our Chinese colleague, 40 to 88% of the symptoms were neurological in the COVID-19 patient. So also is interesting because the neurological symptoms can appear even in asymptomatic respiratory patient and can precede the appearance of a respiratory syndrome or can follow the respiratory. So we can have different population, like population that show first the signs, the neurological and psychosensorial signs of COVID attraction to the brain, or we can have patients with neurological and psychiatric symptoms following the infection. And this make things even more difficult. The importance of this potential threat has been known since the very beginning, because we know already that since the pandemic at the end of the 19th century, and the other one, the most popular, the Spanish flu at the beginning of the 1919, after the pandemic have been developed from the Spanish 1 million of cases of lethargic encephalitis. So we know that this virus are really represent a threat for the brain. A more recent coronavirus infection, the SARS, in the beginning of this millennium, 2004, have already documented the risk of mental health and related disability. This is an interesting study published by our colleague in Hong Kong with the title Mental Morbidity and Chronic Fatigue in Severe Acute Respiratory Syndrome Survivors, Long-Term Follow-Up. As it is interesting because in 2009, they published that while the symptomatology related to the respiratory component of the disorders were gradually reducing, presence of neurological symptoms increase during the time. And at the end of the 4 years, 40% of the patient monitored that had been infected with SARS-CoV-2 had de novo, that means without previous episode, without previous history of psychiatric disease, the presence of a psychiatric diagnosis. And this was related, after 4 years. So they have a progressive increase of a worsening of behavioral and psychiatric disorders. And that was related to the cytokine storms, was not associated with corticosteroid treatment. Most common, of course, was post-traumatic stress disorder. But if you can see that 40% were depression or sleep disorders or pain of fibromyalgia, chronic fatigue syndrome, and 15% obsessive compulsive disorder. This is why I'm special interest, because we know that the sequela of COVID-19, as much as the SARS-CoV, was more relevant for disease related to basal ganglia dysfunction. That means all the field of OCD and related disorder, obsessive compulsive and impulsive disorder. The functional disability was so severe that after 4 years, most of the people had lost their job. So, and it's extremely important that the disease was not relieving from its own, but was worsening without any apparent intervention adequate to reduce the inflammatory activity and the impact on the behavioral and cognitive functioning of the inflammatory activity. So we know now that there is a list of symptoms that are assessed at the onset, at the admission of a patient with COVID, because this is one of the first paper that I published in March about the importance of anosmia, because anosmia has been included as one of the symptoms of presentation of COVID-19. Loss of smell and loss of taste has been both considered as a marker of a potential infection of COVID-19. In this paper, I also highlight all the other part of the syndrome that involve not just a reduction of a sensorial perception, but a more deep experience of the realization, the personalization that run together with the reduction of this perception. So this is a call for a different stratification of a patient. We cannot only consider patient in terms of their exposure to the psychosocial stress, but we have to consider that there are some of the patients with psychiatric and psychological disorders that are directly connected to the virus on the brain. So there are two populations mainly. The population that is just psychologically traumatized, and there are another population, probably a broad one, with people that have medical consequences. And this is probably the population that experienced more psychosensorial symptoms during the previous the respiratory one, or neurological symptoms, have some specific inflammatory markers. Some of them easy to collect, CBC or D-dimer or interleukin-6 that we can assess in this population. So according to the first observation that loss of smell and loss of taste could be part of the assessment, you see here the Public Health England that include in the case definition items also neurological manifestation, loss or change of normal sense of taste or smell as one of the definition. But if you go, if you have a look of the discharge of patient, there is no mention of a neuropsychiatric or psychosensorial component of the disorders. And they only mention that this patient have to receive a proper and appropriate clinical assessment without specifying that this should involve neurological and psychiatric assessment. I don't argue for everybody be assessed by a specialist, but I'm saying that physician in the intensive care unit and family doctor had to be aware that there is a large part of the population that could suffer for this consequence of inflammation, just showing behavioral problem. And for that patient, just a psychological support without an opportune screening of inflammation and maybe a different assessment of neurological functioning and also a change in the treatment could be not enough. So this is why we are now validating a neuro-COVID-19 screening test that distinguish between the different area of symptoms, mostly energy, sleep, psychosensorial, cognitive, motor symptomatology that can be part of the assessment of this patient in order to get the early signs of the involvement of the brain and to prevent the long-term sequelae that we have observed with the paper published by the colleague of Hong Kong, where 40% of the entire population of the patients suffering for respiratory form of SARS have, after 4 years, new onset of psychiatric disorders. So, as a conclusion, we recently published last week this paper, Neuro-COVID-19, a clinical neuroscience-based approach to reduce SARS-CoV-2 related mental health sequelae. It is a claim for a screening that involves this dimension of the disorders, that mean clinical, psychosensorial, neurological symptoms, and inflammatory panel, considering not to separate psychological support to the medical one, should be in continuity on a multidisciplinary panel. And also, this is a claim to improve also our culture, because we know that in all the field of psychiatry now there is a large interest considering the importance of inflammation in the vulnerability and in pathogenetic mechanism of the disorders. Now, we must be aware that we are probably facing a large number of patients produced by this combination of inflammation and stress, and we have to start to use in a new way our medicine, because we know that, as an example, SSRI, serotonergic agents, have a strong anti-inflammatory effect, and we have to use it in an adequate way. I told you at the beginning that fluvoxamine is now, there is a trial to use it in the acute phase as an anti-inflammatory, and the use of some anti-inflammatory for the treatment of this so-called mental disorder that are not mental at all, but are related to the inflammation. So this is a threat, but it's also an opportunity to improve the quality of our assessment to this patient and to improve the culture for the adoption of adequate response to this very vulnerable population, in order to prevent what has been reported with the SARS, that 40% of this population will be still sick after years. So it's open to all the discussion. Thank you for your patience.
Thank you so much, Professor Palanti. Very insightful, little scary. Just a question, and I know we've got many questions which have started coming up. From what I understood, PTSD, over 50% more cases happened with the previous experience. Does that get handled by counseling, or do you actually need to get into medical treatment to handle PTSD? And I know I do want to get onto the other speakers, but before I lose track of the points, if you could help us understand this a little better.
So thank you for the question. Psychological intervention has also a potential anti-inflammatory effect. So I'm not saying that psychological intervention should not be the right things to do. We can start, but of course we have to monitor the patient, and in the monitoring we have also to include the assessment of some marker of inflammation, because in that case probably psychological intervention could be not enough. In fact, patient that in the paper I mentioned, patient and physicians that had lost their job because of the stress of the pandemic remain unemployed after years. So I think that is a difficult condition to treat, but you need a more deep assessment.
Okay, and so you would suggest that people do their self-assessment with the tool that you've presented or taken us through, and then take a call on whether they need to go to a psychiatrist or not. Anybody who's actually contracted the virus itself, right? Okay.
Right. Yeah.
All right. Okay. So while there is a flow of questions that are coming in, and thank you, please keep sending your questions. I want to make sure that we cover all our panelists because there are different dimensions which will keep coming up. In fact, one of the things Mr. Sopti had mentioned in his welcome address was the fact that there was economic uncertainty. In fact, we all know that we're all being affected. And to that end, we've got nobody better than Dr. Amita Saha to talk about this area. Again, Mr. Sopti has given an introduction, but Dr. Saha is a senior consultant practicing in Delhi NCR. He is affiliated with the Department of Mental Health and Behavioral Sciences with Max Hospitals, both in Vaishali and Noida. And he is the head of Department of Psychiatry in Holy Family Hospital in Delhi. Dr. Saha and I had a discussion some time back, and since you, Professor Palanti, had just mentioned about the SARS virus, I don't know anybody, other than Dr. Saha from Indian background who actually saw it upfront, face to face in his stint in Singapore. He came up with a lot of experience, and I'd like to share that. Although your topic, sir, today is the challenges faced by the workforce, but if you want to make a comment on how panicky we should be, having heard Professor Palanti's presentation, please do that. Just one last thing, which is Dr. Saha has done his MBBS from MAMC and his MD from AIIMS, and we welcome you. It would be wonderful to talk about the cases you're actually dealing with right now, sir. We will have the presentation share. Technical team, could we please have the presentation? While we're waiting, Dr. Saha, if you could. We can't hear you, Dr. Amita.
Just, can you see my slide?
Yes, we can see the first slide, challenges faced by the workforce in uncertain times.
Good evening, viewers. In the time of the coronavirus pandemic, a new normal has set in. We know classrooms are empty, children are on their mobile phone and laptop for classes. Law enforcing, instead of catching criminals, our police is enforcing restriction so that they can contain virus. There's no handshake, there's no carpooling. So today my presentation will be different from conventional mental health workforce presentation. In this presentation, I'm not going to talk about satisfaction of job, role ambiguity, work performance, work-related stress, reduction of absenteeism, or increase in efficiency. I will limit myself on how can we preserve mental well-being of our workforce and their family in this calamity. Now, if you ask me the extent of psychological problem, I will not present any figures. Everybody will present you figures that may be confusing. I will just use one word, alarming. This is this pandemic is going to be followed by a mental health related pandemic. What is happening? Why? In the environment of uncertainty and immense stress, a psychological problem have increased markedly, especially depression. Many psychological problems in form of anxiety, PTSD, obsessive compulsive disorder, and what we call hypochondriasis, concern with the physical problems, concern with whether I have a corona or not. This sort of a concerns. So many patients we see nowadays. So many calls we get, and both coronavirus and this coverage of our celebrity Sushant Singh Rajput death has led to a quantum leap in suicide rates. Because all of us are staying in a house, working from home, there's so much of a close proximity, family discord has increased. Because of a boredom, substance abuse has increased. Patients with psychological illness, their problem has aggravated because of increased stress and restricted medical health. So, what led to this psychological mayhem? It's just coronavirus? No, it's not just coronavirus. Yes, coronavirus has a significant role to play, but restrictive movement and the misinformation by our news channel and social media. Coronavirus rapidly spread globally and high mortality has instilled fear, terror in the mind of people. If I or my family get infected, what happens next? And those who are infected, fear of complication, availability of bed in a hospital. As Professor Palanti said, the illness by itself has a direct psychological impact too. What this lockdown or restrictive measures have done, because of a confinement, change in routine, working from home, schooling from home, temporary unemployment, lack of social interaction, lack of amusement, limited international and domestic movement, restricted meeting, and the restrictions, meeting and care of corona patient, disposal of dead bodies of near and dear without proper ritual. All this has led to a psychological unrest, and it manifested in a different form. Two, all this, the news channel, what they have done, they have propagated all the negative news 24/7, and the bombardment of fake articles, health-related material in social media, which actually propagated stigma, discrimination, and misinformation. So, what are the issues as a employee or as a workforce a person confront with? First is workplace. Where is my workstation? Is it adequate safe measures have been taken? How I reach there? The public transport is not available. If I am working from home, I have a multitasking. I have to do office work. I have to look after my children, whether they are actually, I have to monitor my children, whether they're actually attending online classes, and household responsibilities too. Working from home, there is also overcrowding. It's not just you, your children, your spouse, everybody is in front of computer. And for everyone, their work is important. So there is an overcrowding. The other important concern is blurring of office hour. When it starts, but it never ends. There are other issues also, financial issues. People who are running on high EMI mortgages. People have to think about their children's school fees. If someone get affected by coronavirus, they're not sure whether they will get a hospital facility, whether they have adequate coverage from the company or not. So there are concerns. And there are many people in an organization who have already depression or other mental health problems. Their problems have increased. So these are the concerns that we are confronted with. So what is the solution? My advice to employees is to first protect yourself and then support others. Listen to advice and recommendation from national and local authorities. Avoid news channels propagating negatively. Only view trusted channels for few minutes in a day. Limit your screen time. Have proper hygiene. Eating habits. Follow office hours. Do exercise. Sleep in time. Curtail those propagation of misinformation through WhatsApp messages. Interact with your family members, children, elderly. Elderly people are most affected because they can't step out of house. They cannot step out of a house, and they feel insecure about themselves and the whole family. You need to form a peer group, peer support system. Collective approach only can help to mitigate stress among the workforce. So you have to make a sincere and frequent interaction with your family, friend and colleagues. My advice for people with a leadership role. Most of these PSU organizations have an elaborate human resources services. So they need to inform workers about the safety measures in the workplace, health coverage, tie-ups with the hospitals or a health facility if the crisis happens. They need to see Corona and government has taken all the control from us. So give some sense of control. Giving some sense of control will help. If there is an issue, ask the employer about the solution. Same for the working hours. We need to be very considerate about the working mothers, because apart from the routine household chores and office work, working mothers have now this burden or extra responsibility of monitoring children who attend online classes. The sense of purpose must not be lost. This is also very important. If a person is sitting idle in a workplace, he feels himself a liability. So everybody must be engaged in a work, and if there is a little work, they need to be trained, or their skills need to be upgraded. Some course they can attend that will benefit their career in future. To help loneliness, hopelessness, and to boost morale, there should be frequent virtual interaction among the peers, colleagues, like a virtual coffee, having a virtual coffee. Organization need to create a assistance program in collaboration with the mental health professionals to initiate and follow up surveys for those who experience mental health issues. And there is a responsibility of creating awareness about mental health problems and to destigmatize it. Now, this is for everyone to know that there is some problem. There is some mental health problem. You need to talk about it, either with your colleagues or with a professional. You need to know the signs. If there is a mood swings or low mood for a prolonged duration, increased anxiety, apprehension, irritability, if you feel hopeless, helpless, worthless, if you're not interested in anything around you, you don't feel like interacting, you're not able to concentrate in routine work, either sleeping more or sleeping less, you were sleeping, but when you wake up, you don't feel relaxed. If you get thoughts of self-harm, then you need to consult a professional as early as possible. My concluding slide, I just wanted to say the takeaway message is we will walk through this calamity collectively and confidently. I'm sure we will be able to defeat this. Thank you.
Asha ma'am, please unmute yourself.
I am unmuted. Now can you hear me?
Yes,
Can you
ma'am.
hear me? Yeah, excellent. You know, there's so many questions that are coming. We're getting flooded. We do have 2 speakers. Please keep your questions flowing. If we have to run over a bit, with the permission of Mr. Sopte, sir, I do need to address as many questions as I can. We do have 2 speakers who have put together a lot of content. In fact, Dr. Saha, while you were talking, there were many questions which may have been already addressed, but I am going to run through the questions. I don't want to waste too much time because we're running a little behind. Dr. Nagpal, I'm going to ask you to please talk about the most critical thing, which is how does one know? And you raised the entire thing of a celebrity. You know, we don't know whether it's homicide, suicide, so on and so forth. But there are just so many cases of people who are getting into anxiety, depression, suicides for the longest ever. Ma'am Nagpal, you really need to tell us, how do we identify a person who's going through mental health problems? But before we start off with you, may I please give a little introduction about yourself. You're going to talk about recognizing and helping a person with a mental health issue at work and home. You are the founder of Serenity Clinics, ma'am, twice awarded Global Top 50 Mental Health Leader, both in 2019 and 20 by ET Now and World Mental Health Congress. You have received Hero Leadership Award in 2015. What an honor it is to have you amidst us. You believe in holistic approach in handling mental health problems through counseling, yoga, neurogenetic diet, and lifestyle management. You're exploring drugless psychiatric treatment, and you are at the leading edge of treating mental health conditions through brain mapping, neurofeedback, and RTMS. This sounds like music to our ears. And ma'am, please tell us, how do we identify somebody who's going through a problem? You can't tell. Over to you, ma'am, and your presentation. Please send your questions. I will address them just after we've had the 2 ladies finish their piece, please. Please bear with me. Thank you. Ma'am, over to you.
Thank you so much, Asha. So it's really an honor for me to actually be here and doing this presentation. I'm not able to actually come to this.
You're organized.
Yeah. You will have to actually start my presentation.
Oh, okay.
Yeah.
I hope the scope technical team has got that.
Ma'am, you want us to run the presentation? You are the presenter.
It's okay. I think we can do it now.
You're okay.
Yes, ma'am, we can see you.
Yeah.
Yes.
Full screen. Nice. Yeah, perfect, ma'am.
Okay, so today I'm supposed to talk about, how do we know that we have, the person who is sitting right next to us has some sort of a mental health problem, the co-worker that we have or the colleague that we have who actually appears to be, always full of rage, or who is always bossing around, not ready to listen to what you are saying, or who is actually, taking all the ideas from you and presenting it, as if it's his own. Is it because this is the way this person is, or is it because it is something to do with a psychiatric problem that he may be having? So, how do we identify that whether this is a mental health problem or not? So, mainly what we can see is there may be mood changes in a person, that this is very easily you can find it out. Somebody is depressed, somebody is being too high, somebody probably, is too, dysthymic, not feeling happy most of the time, or they may be worrying a lot. Or, in extreme cases, not very often, probably in our day-to-day life, we may find few people who are talking to themselves or who can actually hear voices. But yes, quite often we can find people who may have, some sort of substance-related problem. It could be just about, the most frequent, substance that we may actually overlook is food. So that could be the case, somebody who's having some sort of a eating disorder, or it could be alcohol, or it could be something to do with smoking. Or, especially in these days, sleep may be a big problem. It could be just about, as I'll be talking later, it could be the quality of sleep, or it could be the initiation of this sleep, which could be a problem. Or sometimes, the mental health problems, because it is not acceptable to the society and to that person, to accept that they have a mental health problem. So it may be expressed as bodily symptoms, which is very much acceptable in the society, which can be, either it could be some sort of conversion may happen, or it may be, some sort of dissociation that may happen. Or there could be a change in the libido, or sometimes, especially in the workforce, I would say it is more to do with the executive and the higher executive dysfunction. That is, the planning part, the memory, or, some sort of, in which you cannot actually concentrate. You may not be able to solve a problem, or you may be having some problem with the motivation. So these are the sort of things, which if you are finding, then that means that might be, these people may be suffering from some sort of mental health problem. So these are few things already, Dr. Saha has already covered these, but just to go a little bit about it, what can happen is, of course, that absenteeism may happen, and depression, of course, we all can somehow make it out, some person who is low, but not always, sometimes it may be, they may actually put a sort of, facade that they are very happy, and inside they may be actually feeling, really sad. And then anxiety, again, we can see an edgy person, always restless, always wanting for some sort of a reassurance, or, sometimes even obsessive, sort of actions may be there. But one thing which may be overlooked is bipolar. These people are highly energetic and creative, and they may be actually doing a lot of work, and they may have some sort of grandiosity that they feel that they are above everybody else. And they may not like to actually follow the rules, and they may be very aggressive at times. They may work a lot, but the net result would be zero. So the direction is not there. So that these are the sort of people sometimes I get from the corporate, wherein we diagnose them as having bipolar disorder. And then, of course, ADHD may also be there, adult ADHD, wherein the person may be disorganized and, they may not be able to follow the deadlines, and, the workload they cannot manage, or, they cannot follow the instructions properly. You tell them 3-4 things and they are not able to actually, follow them up, all of them. Then they may be a little argumentative, because quite often ADHD also is associated, a comorbidity may be that you may have oppositional defiance, wherein, for everything positive, anything, they will go just to the, the opposite of what is expected out of them. So, of course, now let us talk about why does mental illness happen? What is the reason behind it? We say heart attack, okay, fine. The blood is not going, that part of the heart, infarct happens as a result, the heart, or either the electrical part of the heart is not working. That means that the stimulus which has to go, the pumping is not happening. Similarly, for everything, we have a reason. Why does mental illness happen? So first of all, very, very important factor that, nowadays actually is being explored is that there is a lot of genetic basis to it. We always knew. But for the last 10 years, a lot of work has been done. And it has been found out that, for illnesses like bipolar and schizophrenia, the inheritance may go even above 75%. It is called as this genome-wide association study, which has been done in many countries together. And there they have found out that how much we knew, it is much more than that, the heritable sort of component to it. Then, of course, stressful events could be there, chronic medical condition, if already you are having some liver problem or some other problem, and during, you may actually feel depressed. Or, if you are having alcohol or any sort of recreational drugs, anybody who is having alcohol, as a social sort of drinking, it's still fine. But if it goes beyond, a level wherein either dependence is there, every day you're looking for it, or, whenever you are drinking to lose control, then there is something, you need to actually start taking charge of it. Because after a stage, the brain structure start changing when if you are taking the same substance again and again. And this is where, the reward cycle is actually getting affected. And, again and again, you will be wanting to have the same sort of, substance, and yet the amount may have to be increased. Then childhood plays a very, very important role. The first few years, how the child has been taken care of. Earlier, it was said that the first 3 years, but now, of course, recently I was reading, it is not just the first, 10, 15 years. It's even beyond that. I think there is a recent research in London, it has been done, that even in adolescence, the sort of family that a child has, it's very important. This is how the personality is going to develop. Let me just point out that personality is something which, the part of the brain where which decides about it is the frontal lobe. And the frontal lobe is the one which matures the latest. That is, after 18 years of age, the frontal lobe starts maturing. So anything that you are doing from 18 years to 25 years of age, that becomes a part of your personality. Because your healthy adult brain has never learned how to actually be without that substance or that particular sort of habit. So it is very important for us to take care of our kids during this time, during 18 to 25 years of age. Then similarly, if the social, sort of interaction is very, very important, the healthy relationship and all these things are actually very important. And of course, if you have a previous mental health, problem, then again, it may come out to have some sort of problem. Now, I will be actually discussing a few of the, scenarios or, symptoms which may be, difficult to handle these days. So how do we know that a person is actually going to get violent? The first and foremost is that, what is being done because of which this person is going to get violent. If sometimes it so happens that a lot of controlling behavior may be there. Quite often in families it happens, sometimes, especially in Indian setup, the financial control completely is kept with the male member, and the wife may not be allowed, or it could be vice versa also, may not be allowed to spend at all. So this is also a type of a violence in a way. Then humiliating a person in front of others, or calling some sort of names. Then physical abuse, that is beating or whatever, sexual abuse, of course, and then any sort of violence to elders or children or pets, it could also be there, and then any sort of agitation. So how do you, of course, we can come to know if somebody is going to be violent, but these are few of the signs, which have been pointed out, that the person may be staring, the tone may be raised and sarcastic, and he may get anxious, and he may start muttering and pacing. That means, this person may be about to get, violent. So now, after this, I just want to, mention a little bit about domestic violence, because there has been a spurt of, incidents of domestic violence during this lockdown time. Now, of course, the things are opening up, and it may not be that bad, but still, I would say that it is very, very important that, all the members have separate times and together times. So all this time being together is not a very good idea. You should have your own life as well. It goes for both male as well as female. You should have your own set of friends as well. And then, of course, there should be times when you both want to come together. And then, sometimes you may understand that, some problem is going on and the conflict is escalating. So it's very important, it is not important to be right at that time. It is important for that problem or that's, that particular sort of, flare up to actually diffuse. So give the emotional space which is required. Just don't, be very particular about small things. Just see whether it is important that this person, whether you are right, or whether it is important that you both are together. Of course, these things should be discussed. I don't say that just hush it below the carpet, but look for the right opportunity when the person is in the right frame of mind. It is very, very important when anybody is saying something. You have to understand what is the emotion behind that, that thought or that behavior. So it is very important to know, do not judge that person on on that particular sort of, what that person is saying. It is important that you understand why is it happening? What is the intent behind that? Okay, then focus on the emotions. Yeah, focus on the emotions behind the behavior. And it's sometimes it is very, very, important to agree to disagree. That's a beautiful way of living. That, okay, fine, you have your way of thinking, I have my way of thinking. We are two different individuals, and it is perfectly fine that, we disagree on few, probably ways or values, but that's okay. That is the way we are. That is how we are comfortable being. Have your hobbies and, exercising and, work also. So all these are important. So now when you come across a person who is getting, you feel that they may get violent. So what are the sort of things that, steps you have to take care of. This is something which I think has been given by WHO. So first is that you have to maintain distance. Secondly, you have to be you need to have empathetic glow. You should not be, too get too close to that person, yet have a detachment that, okay, fine, I can understand you have a problem, and that it should seem, you should not get overly emotional. You should be calm. It should seem that you can control the situation. Then, of course, be careful where that person is standing, or what is there in the hand, if he can hit you with something. Then, keep on talking to that person. Do not say anything negative at that point. Don't say anything punitive or, judgmental at that time. But keep on, de-escalating that particular situation. Then, if required, of course, we may try to actually stabilize that person in other ways. So the second thing which I wanted to talk about was suicide. Now, in suicide, we have, as we have seen with Sushant Singh Rajput, whether it was suicide or murder, we still don't know. But anyhow, so how do we know that a person can commit suicide? So these are the risk factors. This person would have made an attempt or would have always talked about it. Okay, there may be a presence of any other, mental disorder or some sort of substance abuse, or if there is a family history of suicide, and there may be some sort of chronic physical or terminal illness. And whenever the case may be, always make it a point to ask the person. If any client comes to me, I ask them, do you think that there can be some sort of, self-harm, deliberate self-harm in your case? Or I may even say that, do you think you may actually try to commit suicide? And if these people are sometimes just waiting to actually bring it out. So don't think you're going to actually plant this idea. This person is already going through that. So you will in fact help that person in bringing those ideas out. So for that, of course, what we do is we ask them to actually sign a pact before they go. Of course, we inform their family, talking to the family, friends. Then we ask them to have some sort of a diary and, of course, start seeking help. So what are those things, which we can do to, help somebody? So you can always tell them that I'm here to help you, and you can say whatever you want to say. You need to be sitting there and be a good listener. And do not make, any sort of, comments like, there's nothing to worry, don't think negatively. No, you should not. You should actually make that person to come out with his or her problem. Never be, judgmental, and, never say that, okay, I think you should have taken that chance. I think you should have, acted in time or something like that. Never try to tell that person, that he has or she has failed. So, and at that particular point, show empathy and tell them that, be with them, tell them that I'm there, I can understand whatever you're going through, and, be supportive. And, of course, as I said, ask them to sign a suicide pact before they leave. So, and this is very much, avoidable. It can be, if you take care of it in the right way, you can actually avoid this sort of, circumstances. Now, the third one, which is again very prevalent, is about insomnia. Insomnia is about sleep. Now, sleep could be of many types, problems. It could be that you are lying in your bed and, even after 15-20 minutes, you cannot sleep. That is, the initiation is a problem. Or you are getting up in between, or, you are very light sleeper. That is, might be the quality of the sleep is actually, fractured. Or it could be that you get up early in the morning and you feel like crying right in the morning, which could be a case of, sometimes in depression, that is a particular type of, symptom we see, that they get up early in the morning and they start, feeling very, very low. Or, so we have to be careful that, what sort of sleep problem is there. Now, having said that, we do have to understand that, sleep is something which is, controlled by a particular sort of hormone which is produced by a pineal body, which is called as melatonin. And there is, if you go to the bed at the same time for 1 week, most probably you will be able to come out of this, because the hypothalamus actually, takes 1 week for adjusting. So that is the amount of time which is normally, taken if you are jet lagged. So, similarly, if you actually stick to some sort of, sleep, hygiene, you will be able to handle that. And, the cause, of course, could be any. It could be the travel, stress. It could be poor sleeping habit. You always have either your mobile or your, laptop with you, or you are eating too much in the evening, or probably, you are doing exercise very late. That could also be one of the cause, and that becomes very activating. Or you may have, either, caffeine, nicotine, or something late in the evening. So what are the risk factors? If you are a woman, you are over 60, you already have a mental health disorder, or you are under a lot of stress, or you don't have a regular schedule, all these are at increased risk of having sleep problems. So how can we do that? Of course, the first and the foremost is follow the sleep hygiene. It is very important that you have your bedtime, your wake up time, which should be fixed. Stay active throughout the day. Check your medication. Sometimes some medicines, they may be very activating. So you just check whether any of your medication has this sort of a side effect. Then do not, sleep in the daytime if you are having problem with your sleep cycles, especially. Do not take caffeine, and food. And, yes, and the very, very important is that your bedroom should be there for sleep. So whenever your brain actually sees the bed, it should register that, okay, this is time to unwind. Let me start getting into that cycle. So that is how, our circadian rhythm is such that we actually adjust to, this is the internal body clock that we have. So it will adjust according to, the routine that we are having. So it is very important that we have, dark room, then cool sort of, environment, no noise, and, all these things are very, very important to have a good sleep. So having a bedtime ritual is again, this is again a sort of, a condition sort of reflex that can happen, that your brain starts registering that, okay, this is time to sleep. You may either have a warm bath, and then, you start reading, not something very activating, something, which can actually put you to sleep, or music. These all can help you. Now, what all can we do is, how can we maintain our mental health? We need to have a routine. This is, 6 hours it came up, I thought that, see, restriction may be there, relaxation, relationship, rhythm, and resilience. So one by one, I'll go very fast. So of course, you need to have a routine. You have to make your bed, you need to have fixed meal time, and you need to have regular breaks. So these are very, very important. Then similarly, restrict yourself. Do not see too much of your screen, restrict your screen time. If possible, just take off those apps which are there in your mobile, and like, mails and all, and put it on your laptop, and put your laptop away, so that you are not watching them all the time. Relax. It's very, very important to relax. Hobbies play a very important role. What I tell my clients is that there are 3 types of hobbies which everyone should have. One is, something which is intellectually stimulating. A second set of hobby is something which is physically keeping you active. And third is something which keeps you creatively inspired. So if you have these 3 set of hobbies, it will take care of your mental health somehow. Breathing exercises you can do, and, mindfulness, hot water bath, all these things will help you as well. Similarly, being with people is very, very important. There is genetically, we have Professor Palanti would actually be, saying it, that we have genes which actually decides how much we are going to be, socially attached to others, or showing, you know, how much empathy. This genes is actually OXTR, which decides, you know, how much oxytocin you are going to produce, and this actually decides. So few people who do not have that, or have a mutation wherein they cannot actually, they do not like meeting you other people, we have to tell them, no, you should do it, because this may not come naturally. Genetically, you are predisposed to actually being away, aloof, but you, for your robust mental health, you need to make an effort to be with others, you know, and that can actually help you a lot. Then you know, joining religious activities, Chalia, Friday prayer, and all those things can also help you. Similarly, having a continuity is very, very important. You know, following some sort of a exercise regime or a serial, this can also help us. So one thing, you know, which can build resilience, as Professor Palanti had already mentioned, you know, 2-3 days back, is gratitude. So lot of work is being done on gratitude. You know, feeling good about, feeling thankful is a big, you know, sort of virtue in itself, which is actually showing that it can increase the longevity and you can live longer if you have this. And you know how flexible you are to change. So these are few of the things. So similarly, if you have a person, of course, listen to him, you know, inquire about their needs and concerns, validate them, tell them that, you know, you believe them, enhance their safety, tell them that you are there to actually safeguard them, support them, give them the right sort of information, services, or whatever sort of, you know, social setup that that is required, you know, is there. Just give them those information. And of course, you know, refer to mental health. When there are extreme cases, then you need to refer to mental health. So thank you so much. I'll end here.
Thank you very much. Can you hear me, everybody? Yeah?
Ma'am, you're audible.
All right, thank you very much. And as is always the case, the last speaker gets the least amount of time, for which Dr. Alma, I can only apologize in advance. What can I say? So, you know, there's so many questions coming and I'm waiting to get onto them, and I know we're completely run out of time. But I know you worked really hard in your presentation. In fact, the next few questions, or the latest questions we've been receiving, ma'am, are on children. Okay. And you know, you are a specialist when it comes to child psychological and adolescent psychological health. I'm going to cut your introduction really short, please. Okay. But you are based in Maryland, USA. You are going to talk about child in distress. We will take the question and answers just after your session. So please keep your questions coming. You are practicing child and adolescent psychiatry in Maryland, USA. You have passed out of Lady Harding Medical College from New Delhi. So that's good to know that you know India completely. And you did your psychiatric training and fellowship in child and adolescent psychiatry at Mount Sinai School of Medicine, New York, in affiliation with the Elmhurst Hospital Center. You are a member of American Academy of Child and Adolescent Psychiatry and have served at, and I don't know if my pronunciation is right, but you've served at Bergen Regional Medical Center, New Jersey, Shepherd Pratt Hospital as well. Over the last 25 years, you have provided consultation to adults, primarily children, in various settings, including school, group homes, outpatient clinics, residential treatment centers, private practices. You're a strong advocate for psychoeducation of parents and caregivers, parent counseling, strengthening families, early identification of high-risk families, timely intervention, and continuum of care. Ma'am, you look at children who suffer from all kinds of mental health disorders. And may I please request you to, as quickly as you can, so that we can actually do a Q&A session. Sorry. Yeah. Okay. So if we can have you have the screen share. And you just need to do full screen.
Am I visible? Okay.
Yes, you are. I can see your first slide.
Thank
you. Just do full screen.
Okay. Thank you, Ms. Asha, for this opportunity. I'm honored to be part of this panel. And without much, wasting much time, I will start. So COVID-19 has caused profound disruption. Can you hear
I'm
me?
sorry to interrupt.
Yes, we can.
Ma'am. Yes, you're audible, ma'am. Can you put your presentation on slideshow?
Oh, that's
Yes, ma'am. Yes, ma'am. Yes, ma'am. This one only.
Which one?
yes. No, you're fine.
So-
Dr. Verma, do carry
Yes.
on.
Okay.
Yeah.
So COVID-19 has caused profound disruption to the normal rhythm of everyday life. That is, it has caused uncertainty for all of us, including children and teens. For children, schools have closed down. Their sports and activities have shut down. They cannot visit family, friends, grandparents, extended family as they used to. And being sheltered in one place or being home all day, that has affected their playing and socializing. Playing and socialization is a vital part of their lives, and that's what they thrive on. Next.
You can just go to the left and press the next slide. Yes. Yes. Yeah.
So this has created a lot of uncertainty or stress for all of us, including our children. So during stressful times, no matter what their age, kids and teens want to know, am I safe? Are people taking care of me safe? And how will the situation affect my life? So here are a few tips, guidelines for helping kids of all ages. I took some of it from Mass General Hospital. Number one, most important is control your own anxiety. Anxiety is contagious. If a parent is anxious, child is going to pick on it and say, and he or she is going to get more anxious. And it's important to get the most credible information. About coronavirus, I would ask a parent to go to websites such as CDC, which is, or WHO. So once you have, the good information, source of it is, you can share that information. Avoid social media streams. Avoid breaking news, breaking headline news. They have too much information. They have misinformation, and that can only fuel your concerns. And it's, besides, handling your anxiety, you want to take care of your physical health. Take care of your diet, your exercise. As, previous panelists have already covered, sleep is very important. A good 8 to 10 hours of sleep. Good diet. The caregivers, parents should also focus on managing their anxiety, whether it's yoga, meditation, mindfulness, watching a TV show, or your favorite, play a favorite game, or talk to a relative, friend. It's really important to be calm and do something for your own relaxation. Your child may ask you, are you worried? So be honest with your child. And you can say, yes, I am worried, or I am concerned about this virus, but I know how it spreads, and I know what to do should one of us get sick. You want to approach your kids and ask them what they know. Kids and teens are getting information from all sorts of sources, television, peers, teachers, friends. They may have overheard you talking about it. So you want to ask them what they have heard about the coronavirus and what are their feelings about it? What are their questions? What are their concerns? And by providing them a open-ended questions and a supportive environment, you are asking them to share their concerns with you. And once they share their concerns, you can correct the misinformation or help fill in the gaps in their knowledge. And make yourself available. Be there for them. The children should feel that mom, dad, or uncle, aunt, they are there when I need them. I can easily go to them. They would not be mad at me, and they'll be there for me too if I have any questions or concerns. It's a good idea to do regular check-ins. It's not a bad idea to say, hey, why don't we talk about this every other day or every day? Just even for a few minutes. Check in with the children, check in with your kids, teenagers. Hey, have you heard anything new? Are you worried about something? How are you feeling? What are your concerns? And, honestly, answer to the best of your capability. And if you don't know the answer, It's okay to say, hey, you know what? I'm going to find out. When I know, I will let you know. Okay. When COVID started, kids had more emotional reactions. They were scared. They were, petrified. But now, as things are evolving, things are changing. They may have more legitimate, questions and concerns. Teenagers can ask you, when is the vaccine coming out? Is vaccine going to be safe? Could I please get the vaccine? So these are some of the questions that you can get more information from, a credible website or, your care provider or a doctor, and share with them. That will be very reassuring to them. You can also empower them by modeling good behavior. Demonstrate all the prevention behaviors, such as what does it mean to be social distancing? What does it mean to wash hands, and how long you wash hands? With little kids, you can do, sing happy birthday song and make a game out of it. Sing happy birthday song twice, it's 20 seconds. And, when you are not there, kids will be able to do it on their own, especially the little kids. Teenagers, school-age kids, you can involve them in chores, in helping around the house. Let the whole family be part of this prevention efforts, and let them wipe surfaces. So by doing so, they feel valued. They feel part of, they feel important. And when you see them practicing good hygiene, praise kids. Tell them, hey, good job. You are doing so great. I'm so proud of you. Not only you're keeping yourself safe, you're also helping prevent the spread of the disease. Kids thrive on praise. They thrive on reinforcements, and continue to do that. Continue to provide some positive feedback and positive reinforcements. It's important to provide reassurance. Kids tend to worry a lot, and they like how long it's going to last. So your school-age kids, your teenagers may ask you, how are we going to get through it? How long it's going to last? help kids is, using a family narrative or a story. Do you remember the time we had our house flooded and, grandmom came to help us, uncle came to help us, our neighbor came to help us. We were all stressed, but we got through it. So these kind of family stories are very powerful. They have a, really good impact on kids, and they will give them hope. They make them more resilient. So it's, good idea to remind them of the times when, you have gotten through something stressful. Now, the point, how do we gauge our children's mental health? Okay, most children are resilient and they will manage well with family support, with, parents being supportive, grandparents and extended family around them. They may show some problems like problems with sleep, problems with concentration, but they are temporary or transient. And with, reassurance and support from parents, they should be able to get through this. However, there are some who will have more, risk factors, and they will have more intense reactions, such as they will be more anxious, can show more signs of depression and suicidal ideation or self-harm behaviors. So what are those risk factors? So these risk factors include pre-existing mental health issue, such as a previous anxiety, previous trauma, or history of abuse. Abuse could be physical, emotional, or in sexual in nature. Loss of a loved one, a family member due to COVID or non-COVID reasons. Parent may have lost a job, family instability, financial issues, domestic abuse. So all these are risk factors. So what do we do? So when we see our children, kids, parents know their kids. They know what's their baseline. So if you see certain signs or symptoms that last more than 2 weeks, then it's time to get some professional guidance or help. And I'll come to those, what to look for age-wise, what are those signs or symptoms in kids. For preschoolers, bedwetting. So most kids attain potty training by age 4, boys a little later than girls. So either you see they have achieved potty training and they start wetting their bed again, start going in their pants, thumb sucking, clingy to parents, sleep problems, not eating well, fearful of dark, wanting to sleep with mom and dad, regression behavior. Regression could be, the skill that they had, attained, is they've lost that skill. Again, it could be bedwetting. It could be something like, they know how to feed themselves. They know how to dress themselves up. Like 4 or 5-year-old or 6-year-old can do that. And suddenly they said, no, I'm not going to do that. I want mommy to dress me up. I want daddy to do this for me. This is their way of asking for more attention from you, more of your time. And what can we see in our school-age kids? So elementary school kids or school-age kids can present with more irritability, aggressive behavior, clinginess, nightmares, poor concentration, refusal to do chores, refusal to do schoolwork. They can be withdrawn from their friends and activities. So, and our teens or adolescents can present with irritability, aggressive behavior, clingy, nightmares. They can be combative. The adolescents can be, agitated. They can present with agitation. They can be combative. They can have more argumentative behavior with you. They can be more defiant. They can also present with sleeping and eating disturbance, school problems, poor concentration, delinquent behavior, physical complaints. I have a headache. I have a stomach ache. I don't feel good. So what can we do? How do we help these people? How do we help our kids? First and foremost is, stay calm around them. It's really important that, if you are calm as a parent, as a caregiver, you have a sense of, control, and your child sees you that you are calm and in control of your emotions. Okay. And the other important thing is when we talk to our kids, we want to use language, phrases, examples, words that they are age appropriate or that they can understand. It is within their capacity, language capacity to understand what's being said, what we call as, at their developmental level. So for school age kids, what can we do? Preschool kids, sorry. I'll start with the younger ones. Preschool kids, you really want to monitor their television. So, turn off TV, tablets, smartphones. Kids hear things, see things that can be potentially scary, especially this social media. There's a lot of information out there, and it's a lot of misinformation. And kids don't understand, especially preschool kids, if it's happening, let's say you're in the north part of India and something's happening in the south part of India. Kids may not understand that, this is happening in a remote, and the virus can potentially, or there are more deaths there. They may think it's happening right in there, close to their neighborhood. Also, younger kids, they would need a lot of extra reassurance, cuddles, attention. You want to give them time. You want to play a new game with them. You want to read to them at bedtime, a new book or a new something different. You can do some things with them like hand washing. Hand washing, again, you can make it into a playful game, invent a new song. With your school age kids, with your teenagers, again, you can involve them in being part of the household, helping around with chores. Our middle schoolers, our school age kids, they understand what it means to have a contagious disease. So they understand how coronavirus spreads. So it's important to remind them of good hygiene, hand washing, why it's important to wash hands, wearing a mask, so what is social distancing, and what is the importance of social distancing, how you should do it. And most kids will want to do that. It's very important, and I think everybody, previous panelists have mentioned that, for kids to have a routine. Kids thrive on a routine. So it's really important that have a daily schedule where kids know what time they're waking up, what time they're eating, what time is the school, and after school, what time is the leisure time, what time is the play time or exercise time, bedtime. The routine makes the day predictable, and predictability lessens anxiety. So this is really, really important. I think not only for school age kids, but for everybody, kids of all ages and even adults. I think routine is very, very important. School age kids may want to engage in certain play. They may want to play the same game over and over. For example, they may want to set up a hospital and using their Lego sets, or they may want to play patient-doctor games. And parents, should not be worried about it, that they are, doing the same thing over and over again, or they're playing the same game over and over. This is their way of binding anxiety, mastering anxiety. And this is a normal way of handling stress. So there's nothing wrong with this kind of play. So you don't want to stop them, and let them, play, act out, be engaged in a creative play. Some kids, school age kids, may regress to almost like your preschooler, where they are, refusing to be very clingy to you, or just very much unlike their normal behavior. Usually it is going to be transient, and with support and your patients, they will get better. So it's not a good idea to tell them, hey, cut it out or grow up. That's not acceptable. Just be patient with them. Lots of patience, lots of attention, and they will hopefully go out of it. Adolescents and young adults. So teens are much more knowledgeable about what's going on with the virus, how it spreads, what are the preventive measures, and what are the future risks. So they are also likely not to follow preventive measures. So you may have to have some extra talk with them, or sit down and watch some videos with them, sit down and watch news with them, have more open-ended conversation. Let them, go to a credible website online and find some facts, and then you can talk about it. So keep the channel of communication with your teens and, especially young adults, open, so that you can correct any misinformation, and let them know that you are available for any kinds of concerns, questions, as well as, check in with them. How are you feeling about it? Because it's important to know if they're scared or, what's going on. Again, teens can be involved in, more of household chores like shopping, and they can watch a younger sibling, they can help prepare meals, they can, help you collect supplies should you get quarantined. By helping, I think they feel that they are valued. They're a valued member of the family. They're contributing to something. So they feel empowered. And, when you feel empowered, it lessens your anxiety. So no one knows how long it's going to last, but we can help our kids become, more resilient, emotionally stable, and physically protected as possible through a carefully planned means of engaging with our kids at this time of crisis. The take-home message would be stay calm. It's very important as caregivers, parents, for you to be in control of your emotions, and whatever it takes for you to get your emotions under control, including self-care, mindfulness, yoga, exercise, something to a leisure activity to help you with your mental health. Then again, listen to your kids, be available, lend a ear, be very supportive and welcoming. Create a very welcoming environment where they feel that you're not judging them, you're not going to be mad at them, but you are there for them to answer questions and concerns. And every now and then, provide reassurance, especially for little kids. They need to know things will be all right. Yes, eventually you can say that, yes, you are safe here, your school is safe, and I'm keeping you safe. I'll make sure that you're safe at home, and eventually we'll get through this together. We will be fine. Be a role model. You can be a role model whether it comes to, managing your anxiety, or, practicing good hygiene, hand washing, to keeping your mask on always, or social distancing. You can do some activities with them. The exercise, daily exercise, is very important for all of us. So kids, you can get them involved in, either they can do daily biking or play outside, or you can also do as a family, give them some tools, give them some coping skills such as deep breathing, yoga. There are a lot of YouTube videos catered to kids of different age to help them with yoga, like animal yoga. So it may be a good idea to watch those videos with them, or practice along. Focus on positives. Let them know what's going well. You are healthy, I'm healthy, we have a place to live, we have enough food. Point out what's going well. Okay? And again, I cannot emphasize enough, establish a daily routine. Routine is so important. It will bind anxiety, it will give them structure, predictability, and a purpose. Identify projects to do with kids that might help others, like volunteer to drop off essentials, foods to homeless people, or help out a neighbor who cannot get out, bring them groceries. When kids get involved and they're doing things for others, there's a sense of contributing to the community and feeling important, valued. Last but not least is offer lots of love and affection. So with that, I'll end my presentation.
Thank you so much. Okay, now we've completely run over by half an hour or close to half an hour. There are two ways we can be responding to the questions. And I don't know, I know our guests from Italy and America have a whole day's work left ahead of them. There are two ways, Mr. Sopti, that we can answer this. Either we can individually get all the questions sorted out, or I can take another 10 minutes, if that's okay with you, to run through a few.
It's okay. You will take time.
So, Professor Palanti, I know you may want to, unless you can give us time, there's one question which I definitely need your answer to, as soon as I find the question. But in the meantime, please tell us how to know the difference between hypoxic versus inflammatory changes. That's one question which came in.
So the question is about how the inflammation. Sorry.
So the question, as it was typed out, was what is the difference between hypoxic versus inflammatory changes?
Okay. So, I mean, both the phenomena can have a detrimental effect on the neuroplasticity through different mechanisms. The hypoxia is a more acute and most of the time you have an abrupt change that can be detected either at the clinical level or even with some form of neurofunctional assessment, neuroimaging, functional neuroimaging. Inflammation instead is a less evident and can be not easily to detect because it involves, especially in the brain, the microglia that is activated, and this activation is not immediately accessible either at the clinical level or even with instrumental assessment like function MRI with spectroscopy, as an example, is probably the most effective way to assess that. So the issue is that inflammation can work without hiddenly in the brain for a long time, and depending on the vulnerability of each subject can affect different parts of the brain. And now most of our modeling of so-called mental disorders involve some form of very light inflammation that impact the natural plasticity of the brain. So inflammation is opposed to the plasticity, and therefore can be part of a mechanism of different disorders and diffuse in the brain. The COVID-19 is one of the potential source of inflammation in the brain, and we have to be aware of that and to consider not just the psychological understanding and assessment that is very, very important, of course, but also to be in continuity with some kind of medical assessment to avoid the risk of the long-term consequences of inflammation.
Just as an add-on to understand what you said, Professor, a little better, how many people actually get an inflammation of the brain who have contracted the virus? Are there any percentages of people who, so does everybody who's had the virus get a neurological or inflammation upset or disturbance, or is it a percentage?
I mean, according to the first data we have from China, in the first casuistic being presented, a large percentage of subjects with COVID-19 have neurological signs or symptoms. Something in between 40 and 80%. So a large majority probably of the subject. Of course, not all the subjects presenting with neurological symptoms should have inflammation in the brain. Could be due to different causes, including the psychological stress of a situation. But nevertheless, this deserves a specific assessment. And as I show, it's been already involved in the assessment for the definition of a case, according to UK Health, as an example. But is not yet considered enough in the discharge, because I got the idea and I developed the idea that I published with my colleague from Harvard and Albert Einstein about the importance of this fact, because I was involved in the unit for the assessment of a patient discharged from the intensive care unit in my hospital. And I was surprised that they'd been called only once for 100 patients, because it was not part of a normal routine. My opinion is that is extremely dangerous to discharge a patient from the hospital without an assessment of the neuropsychiatric symptoms. So my claim is for a more close attention of his level of function of his patient, because based on the statistic, a large number of his subjects could have, based on the data published from the colleague from Hong Kong, this could have a long-term sequela. I mean, if you don't treat them, the progress and the increase of the severity can last for years. And so as soon as you can get the control over this process, as much as you can reduce the risk of long-term disability in this population. So it's extremely important, because when the patient is discharged without any follow-up for this specific dimension, can last for months in some form of mild symptomatology without any specific support. So this is the risk. We cannot run this risk. I think that we have to get over, and we have to follow up and to monitor. It doesn't mean that each patient had to be seen by a psychiatrist. This means that medical doctor involved in the care of this patient should be aware of the importance of this dimension of the disorders.
This is very interesting conversation. I wish we had a lot more time to do a deeper dive, because what we've noticed in India versus the rest of, versus the Western world, is there is a change, or there's a difference of mortality counts. We're lesser affected. And so the jury is still open out there to find out why it is that fewer Indians are actually dying from COVID. I don't know from our Indian panel, and it's a pity that Dr. Saha's network is a little poor right now, but maybe Dr. Nagpal, are there any studies in India? Because, inflammation 40 to 60% affected sounds like very bad numbers. So is there anything that we know in India as yet?
No, I'm not aware of, Asha. But yes, I do, see that there's a lot of, as far as the very fact that you are saying the mortality is less, there are many factors which may be contributing to it. It may be because as it is, our exposure is more right from childhood. So our immune system is tuned in such a way. It is more robust, probably, handling infections. So that could be, and somewhere I was reading, it could be the TB injection that we get, TCG. That could be one of the factors, which is probably, so I think it's too early, stage to actually to be able to answer any of those questions. I'm sure that a lot of work is being done, by the premier institutes, and in times to come, very, very soon, we'll be getting the data, and we'll be in a better position to actually comment on anything. But right now, I'm not aware of anything, which might have come. But as far as the mental health part is concerned, it's really, nice to hear from Professor Palanti about, all these sort of changes, wherein there are two ways they are saying, one is that you have COVID and then you are getting the neurological changes, and the second is that you are getting only the neurological, symptoms. So that's what I could understand.
Actually, the question is, are you asymptomatic and maybe you're getting an information? Because one of the questions that I came across was somebody saying that I feel all of the above that you were saying, and especially you, Dr. Nagpal, I can't sleep, I'm stressed, I'm cranky, so on and so forth. So how does one detect, other than, of course, this wonderful questionnaire that I saw, Professor Palanti, on your presentation deck? So,
yeah. So right now, I think, Asha, we, at least, personally, I would say I am not at a stage to be able to say that this is because of, corona, or is it, the pre-existing mental health problem. But yes, in times to come, as we keep on getting data, from all over the world, we'll be in a better position to say that whether this is happening, because of the virus, or, is it something pre-existing, genetic sort of problem which is happening. But right now, I won't know. If somebody comes to me and says that, I have, depression or something, I perhaps will not think about corona. very frankly telling you, I would rather take that, client more as a regular, thing, and, treat them on a regular basis. But yes, from now on, probably I'll keep my radar, open, so that in case such a thing is happening, we can actually check for corona. But yes, the corona anxiety, the thing, the screening questionnaire that Professor Palanti has shared, that of course will be helpful, because those cases are coming. Those we are seeing, and we are actually, handling these, and we probably are actually handling it like any other, anxiety case. But yes, now, we have specific sort of screening tools, and we can actually go ahead and do it specialized work.
Yeah. Only in the interest of time, Dr. Saha, while we lost you for a bit because of the network problems, I couldn't address this question to you, but I have no time to ask you this question. However, later I will connect with you because I think Professor Palanti has raised a lot of red flags, and it will be interesting. Again, I don't mean to panic anybody, including myself. I'm already panicked, thank you. But it'll be interesting to know how to deal with this. We ought to do a little better. Okay, again, Dr. Verma and Professor Palanti, whenever you do want to get back to work, or if you can spend some time, and Mr. Atul Sopti, I can keep addressing all the questions. You need to get me to keep quiet when you're done. However, before you go, let me at least to our international faculty, because I know we can get our Indian presenters relatively easier. I'm assuming, sorry, but I'm hoping. So just to ask our international speakers, so there's a very interesting question, Professor, and Dr. Verma, there's so many children-related questions on you as well. So here's a comment. I don't know whether we're different culturally versus what's happening in the West. So here's a comment. Scared of going out. We are scared of going to the office, but we have to go regularly. Can't understand what to do. Is that the same fear that people have in Italy and in America, for that matter? People are petrified of getting out, but you know what? They're resentful. Do you have the same experience outside of India? I mean, Professor Palanti, that's for you.
About the screening of this patient, I just want to add that inflammation is related mostly to some dimension of depression that have some specificity. So usually when depression is related to inflammation, you mostly find three fundamental symptoms. Anhedonia, that means loss of pleasure, cognitive disorders or cognitive impairment, and reduced energy or fatigue. So it's a specific clinical picture. No? And if you find this and it's related to a previous infection and is time correlated not to, we know that is also a risk factor for suicidal behavior. So I thought that this specific population that have suffering for COVID and then have developed this syndrome with these three main core symptoms should be screened. Not everybody, but of course this should be a more accurate assessment. This is my just to reduce the number, because of course the number of patients that physicians are facing now is huge. I mean, there are so many patients. So we need some screening, and we are offering we are now validating a screening question. So in case anybody want to know him, or to we will please to send to everybody to share, this experience that you are doing now in Europe.
Thank you very much for this. We will take it forward, I'm sure, Dr. Nagpal and Dr. Saha, on what we could do in terms of, better response in India. Dr. Nagpal, just shifting our focus to child health, because, so many questions have emerged. So here's what people are saying, because we've got homeschooling as a, through Zoom or through some web links, etc. People are saying, or a question came in, children are increasingly becoming homebound. they increasingly liking to stay home and do not want to venture outdoors. Is it acceptable behavior? And how should a parent deal with it?
Okay, so that's really a good question. They've been forced to stay at home initially because of the schools being shut down. And as schools are reopening, still most of the schools, I think here as well as there, are online. Okay, so now they are more comfortable. They feel safe in their house. So that is, this is something they are doing for some, now some certain months. So they are getting more comfortable. So it's up to the parent to try and create opportunities for them to get out more. And again, start out in baby steps. Start out with daily walks. Start out with just meeting one friend in a socially distant way in a park. Okay, so gradually you want to help them get over that fear and get them to baseline. And if you see there are some who are really resistant and are more petrified, then they may need some more help and may need to be assessed by a professional.
Okay. Another question which came through is, how do you reduce screen time? So while we can say don't watch media, don't watch YouTube, don't watch Facebook, you can't talk. So what do you do? What do you do in America? What do you advise you?
Okay. So, it is a pretty standard recommendation now by American Academy of Child and Adolescent Psychiatry, by American Academy of Pediatrics, American Sleep Medicine. All these three societies have gotten together and saying, hey, for a school-age kid, the average screen time should not be more than 2 hours. Limit it. As parents, we need to limit it. Okay. So a child should be given this. This is a privilege. This is not a right. This is not a given. Okay. So here it's basically training parents to train kids. Okay. So working with parents, hey, child, again, establish a routine, establish a structure, establish, what the expectations are, and then they can have screen time as a reward. Okay. So it is not, again, their birthright. And kids would fight you. But once they know that you are serious about it, and they're only going to earn this as a privilege, then they'll fall into that pattern and stop, accept the limits or accept the rules. But it's really important to watch what they are, limited, and also what they're watching, the content for every age, especially, young kids, preschoolers, school-age kids, and even teenagers.
Okay. What I'm going to do is, I know it's getting really late. I'm going to ask about 2 or 3 questions, some on child health, and and thank you, Dr. Nagpal and Dr. Sai. You've just given such fantastic content. So just a couple of questions on children. One is a set of people who are saying adolescents, they don't listen to us, and they're getting really bored and they're getting very frustrated. Sitting at home, should we let them out? What do you advise parents?
Yeah, so again, it's a judgment call. Yes, you cannot keep them homebound, but an activity that is safe for them, an outdoor activity, let's say hiking, biking, something that they can do in a safe manner with another peer or, a small group. I think that should be okay. So you don't want,
yeah. Our question was, how do you keep them entertained? But I know your presentation has got a lot of that content covered anyway. With your permission, ma'am, could we actually publish all of your presentations on the SCOPE website and panel?
Yes.
Because yes. Could we do that? Do we have your permission?
Yes.
Okay, great. Somebody wants to know how to cope up with over viewing of TV, and you've already responded to that. In terms of psychological issues, how one could distinguish between a child and adult? How, Dr. Nagpal, how?
See, kids may not be that expressive. So they may be irritable, if they have any problem, or if they're feeling low, they may actually, they may sometimes, they may show brutality, or sometimes, it may be just about their grades, which may be coming down. So these are few things from which we can actually come to know. And like, regression may be there while they were, acting like, according to their age. As the pressure is there, they may start, going into a lower sort of a stage wherein they want to cling to their parents, or those sort of behaviors may be there. But in adults, of course, it's like, if somebody is sad, you more or less you would know that they are, they may be low, or sometimes they may have some sort of guilt, the concentration may be low, they may not be getting the sort of pleasure that they were getting earlier. Then energy level may actually reduce, they may be having all sorts of, pains, aches. So all those things, so this is how more or less, you can distinguish. With the adults, the symptoms may be, is easy to pick. But with kids, they may be cranky, irritable, and I think Dr. Verma will be in a better stage to say on that.
Yeah.
So the way that I can understand, these are the ways in which we can actually distinguish, because they will never tell you that I'm depressed, I'm feeling low or something. They themselves do not understand what's happening to them. So, as the caretaker or as the parent, it's your role, where you have to take over, and you have to actually understand, and you have to provide the right sort of atmosphere and bring that child out of, their problem.
Yeah. So I'd just like to piggyback on what you said. The child, they do not come, they're not verbal, they're not expressive. They would come, hey, mom, dad, I think I have depression. They would act out or behaviorally. And, child has like 3 domains, social, academic, and, home. So any change in their behavior in the academic setting, grades are falling, they're failing. They were a bright A, B student. So that's a change from their baseline. Any change in their behavior, suddenly they're not sleeping, refusing to eat. That's a change. So look for any change from their baseline, and if the change persists, swooshly, this is somebody who had several friends who would like to talk to friends. Suddenly they're saying, no, I don't want to talk to any friends. I don't want to be with them. I don't want to speak to them. I don't want to be on the phone with grandma. So this is a change from their baseline. So when you see a change, and change persists for more than 2 weeks, so it's time to kind of, get some guidance or consult a professional.
Yes.
Okay. So, Dr. Saha, while you were presenting, and I've been waiting for your internet connection to come back strong on. Here's a question which came up, which is, how do you convince a patient that he or she needs to go to a psychiatrist? Because of the stigma, because of the fear, and they're suffering from multiple illnesses like high BP, diabetes, fatty liver, etc. So how do you, get somebody to actually go to a psychiatrist?
See, nowadays the stigma has come down significantly with respect to psychiatric disorder in this part of the country. Nowadays, celebrities do help us in a big way. They have started talking about psychiatric illness and associating with the psychiatrist. They have done our job much easier. With the advent of a modern medication, modern treatment, people earlier used to have this notion that psychiatrist means psychiatric medication means sleeping pill, and they will be dependent on that, or electric shock therapy. Now we have come up with we always tell patients that we don't prescribe sleeping pills only. The psychiatry is not just what we call madness. There are plethora of problems that we deal with, and that is how we are dealing. We are trying to.
Okay. I know we have lost Dr. Saha's connection and signal again. I'm sure he'll come back.
I am very actively involved in a media platform also. So this is how we approach.
Also, I think Dr. Nakwal in her slides did say, please be open and honest and upfront. Talk to people, and so did you, Dr. Verma. Explain to people. So, yes. That's a good takeaway. There's a comment which says, we're scared of commercialization of most of the hospitals and doctors. I have to read this out because it's true. A lot of people are saying this. Only big personalities are given special care, but for common people, it is a big question whether they will survive if infected. It's on their fate. I'm too one among them. What would you like to say to this? I don't know whether it's a gentleman or a lady. They believe that the common person in India will not get adequate care. Is that true?
You ask, may I respond to this?
Yes, please.
Yeah.
It is for the
Sure.
Indian panelists. Yeah.
Yes, sure. Everybody, each and every citizen of India has a right to seek a treatment, whether he or she has a money or a fame name, and everybody gets treatment. It's only a purchasing power, the type of infrastructure they can avail. Otherwise, treatment, everybody gets. Treatment is everywhere same. Only the infrastructure and there may be a variation, but everybody gets a treatment. It's a wrong notion to hold that only rich people get a treatment. No.
And may I add to that, we in fact spoke to a survivor in the initial days of, when you had survivors of COVID, when we just only started interacting with this. And he was saying such fantastic thing about a public hospital, a government hospital in Mumbai. And he was talking about he comes from a really well endowed in terms of high income group family. And he was telling us that he wasn't charged a dime. And he got such fantastic treatment and care. So, for whoever sent this question, we should see we're all getting cynical. I know Professor Palanti and I know Dr. Verma getting a little restless. What I could do, with your permission, Mr. Sopti, help me out here, please, is we could actually send a set of questions individually to all the doctors. Would that be okay with our panelists? So that we can actually upload the responses. I would take that responsibility, and I'm sorry, I will have to chase you for more answers, but we cannot go 1 hour over time. I mean, we've already...
We'll be okay, thank you. Thank you so much.
Right. Okay, so thank you very, very much. There is so many questions still left to be attended. Thank you very much. We're already long overdue. Please keep checking on the Scope social media platform and famhealth.in/community. I promise you, as soon as we keep getting questions for whoever is still hanging in there and watching our webinar, you will find all the responses to all your questions from each and every of our panelists. With this note, I'm going to sign off. Thank you so very much. Your presentations, one thing I thought, which is really rude of me, because I was mindful of the time, your presentations were so fantastic. Your content, each one of you, the reason I didn't push you is because you've all worked so hard to get this meaningful. Mr. Sopti, would you like to make one last comment, please?
Oh, thanks to everybody. I mean, the interest which has been shown by the participants and the kind of coverage which has been done by all panelists. This was fantastic. In fact, I was listening each and every word whatsoever was spoken there, and it has definitely enlightened me. But I'm sure this will help all of us to face this pandemic, especially the mental health issues, which we know is becoming very critical day by day. Thanks to all of you. Thanks for sparing your valuable time.
Thank you very, very much.
Thank you.
For your support. Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you.
Thank you. Bye. Till we meet again. Okay, we'll just wait to get logged off.